Hello and welcome back to SHG Diabetes Education Podcast. My name's Bronwyn Newman. I'm a credentialed diabetes educator and the director of SHG. Today is episode 3, and we're focusing on a topic that is incredibly important for both mothers and babies: the impact of diabetes and elevated blood glucose levels during pregnancy. We'll discuss the 3 main forms of diabetes, which is type 1, type 2, and gestational diabetes, and we'll explore the differences between them. We'll also discuss how elevated blood glucose levels can affect maternal health, the potential impacts on newborn health, practical strategies for glycemic management, and building your diabetes pregnancy team. Let's begin. Understanding diabetes during pregnancy. Pregnancy places additional demands on the body. Maintaining healthy blood glucose levels becomes particularly important. There are 3 main forms of diabetes that may affect pregnancy, and we're going to start with type 1 diabetes. Type 1 diabetes is an autoimmune condition where the body's immune system attacks the insulin-producing cells of the pancreas. People with type 1 diabetes require insulin therapy from diagnosis throughout pregnancy. Women with type 1 diabetes can absolutely have healthy pregnancies, but careful glucose monitoring and insulin adjustments are often required as insulin needs change throughout pregnancy. Type 2 diabetes. Type 2 diabetes occurs when the body becomes resistant to insulin and cannot effectively manage blood glucose levels. Some women enter pregnancy already living with type 2 diabetes, while others may be diagnosed during pregnancy. Management in type 2 involves nutrition modifications, physical activity, oral medications, and insulin therapy where appropriate. Achieving optimal glycemic management before and during pregnancy can significantly improve outcomes. Now we'll go further and discuss gestational diabetes mellitus, or GDM. Gestational diabetes develops during pregnancy when hormonal changes reduce the body's ability to use insulin effectively. For many women, gestational diabetes resolves after birth. However, having gestational diabetes increases the future risk of developing type 2 diabetes later in life. This makes ongoing follow-up and preventative health care particularly important, and that's why I'm discussing this episode today. The impact on maternal health. Pregnancy can already be an emotional and physical journey. When blood glucose levels remain elevated or uncontrolled, additional challenges may arise. Some potential impacts include increased pregnancy complications. Persistently elevated blood glucose levels can increase the risk of high blood pressure during pregnancy, preeclampsia, increased interventions during labour and delivery, caesarean birth, and increased future diabetes risk. This is why postpartum diabetes screening and ongoing healthy lifestyle habits remain so important. Another thing that's incredibly important is emotional and mental well-being. One aspect that isn't discussed enough is the emotional impact of living with diabetes during pregnancy. Many women experience anxiety about blood glucose results, fear of harming their baby, feelings of guilt when readings are above your target, emotional exhaustion from constant monitoring and decision making. Managing diabetes during pregnancy can feel overwhelming at times. It is important to remember that perfection is not the goal. Support, education, and gradual improvements can make a meaningful difference. So now we'll go on to the next part of this podcast and we'll discuss the impact on your baby. When maternal blood glucose levels remain elevated, excessive glucose crosses the placenta and reaches the baby. The baby's pancreas responds by producing additional insulin. This can contribute to several complications. The first being large birth weight, which is also known as macrosomia. This is one of the most common concerns, which is the larger than average birth weight. This can increase the likelihood of birth interventions, making delivery more complex, increases the risk of birth injury to mother or baby. Neonatal hypoglycemia. Following birth, babies are no longer exposed to the mother's glucose supply. However, they may continue producing higher levels of insulin, which can cause a low blood sugar after delivery. These babies are routinely monitored and managed by your healthcare team. Another common concern can be neonatal jaundice. Babies born to mothers with elevated blood glucose levels may have an increased risk of developing jaundice after birth. Most cases are manageable with appropriate monitoring and treatment. And another is respiratory distress syndrome. So some babies may experience breathing difficulties after birth, particularly if blood glucose levels have been difficult to manage during pregnancy. This risk can be reduced through optimal pregnancy care and glycemic management. Improving outcomes through glycemic management. So the good news is that there are many effective strategies available to support healthy glucose levels during pregnancy. Every improvement counts. So a lot of the evidence suggests that improvements that count include healthy eating and a balanced nutrition. Nutrition plays a crucial role in glucose management. So it suggests that you focus on grains and lean proteins, healthy fats, vegetables, fruits in appropriate portions. It says to limit sugary drinks, highly processed foods, refined carbohydrates that cause rapid glucose spikes. A reputable resource that I would suggest you have a look at would be the Baker's Heart and Diabetes Institute that offers excellent evidence-based resources for women managing gestational diabetes during pregnancy. I'd also suggest that you see your obstetric team or general practitioner to be referred to an accredited practicing dietitian for guidance, and they will help you with glycemic management planning with nutrition. Now, the second is regular physical activity. Physical activity helps improve insulin sensitivity and can assist with glucose management. So, insulin sensitivity is making your insulin more productive. It makes it work better. So walking alone improves your insulin sensitivity. It makes it sensitive. It makes it work better. It makes it act. Another example of physical activity to improve your insulin sensitivity includes swimming, prenatal yoga, pregnancy safe exercise programs. The data states that approximately 30 minutes of moderate activity on most days, following advice from your healthcare provider. We'll go on to the third point here, which is monitoring your blood glucose levels. Regular monitoring helps identify patterns and guides decision making. It helps you to understand how food affects your glucose levels, assesses the impact of physical activity. It evaluates whether treatment strategies are working. And remember, knowledge gained from monitoring can be empowering and help you make informed choices. So this is whether you monitor with a blood glucose machine or the available continuous glucose monitors available, which is CGMs. We'll go into the fourth point, which is medication management. Sometimes nutrition and exercise alone may not be enough to achieve your goal glucose level or target range. If this occurs, medication may be recommended. For many women, insulin therapy is the safest and most effective option during pregnancy. Needing insulin is not a failure. Pregnancy hormones can significantly affect insulin resistance and make many women require additional support despite doing everything possible with nutrition and exercise. The goal is healthy glucose management, not perfection. Sometimes you're doing everything right, and we just need further support with medication. So now we're going on to building your pregnancy diabetes care team. One of the most valuable things you can do is surround yourself with collaborative healthcare team. You find a team that collaborates well to provide you the best outcomes. A multidisciplinary approach helps support both maternal and baby health throughout pregnancy. Your diabetes pregnancy care team may include, firstly, your obstetric team or your midwife, your maternal team, credentialed diabetes educator, which can provide education, glucose monitoring support, insulin initiation and adjustment guidance in collaboration with your physician, your obstetrician, your general practitioner, and practical diabetes self-management strategies. As a credentialed diabetes educator, we can also provide you with a blood glucose monitor, a trial of a continuous glucose monitor. So always try and seek out a CDE. The next, I think this is a great provider in your team, is an accredited practicing dietitian. Supporting healthy eating, carbohydrate management, meal planning, and nutritional needs during pregnancy is incredibly important, and I think it's something that we need to grow a healthy, thriving baby and also have yourself. You want a healthy, thriving pregnancy with a good outcome. Women's Health Physio is another provider that you can add to your team, which assists with pelvic floor health, pregnancy-related musculoskeletal concerns, exercise guidance, and postnatal recovery. All of it is important. You're important. So seek out a women's physio. A podiatrist. Sometimes you may need to be provided with a foot assessment and preventative foot care. Particularly important for women living with pre-existing diabetes, and if your glycemic management is in a higher range or fluctuating range. So the coordinating ongoing care and referrals throughout pregnancy and beyond will set you in the right path to live a healthy pregnancy. So your obstetrician providing specialist pregnancy care, fetal monitoring, and delivery planning. Together, all of the professionals create a collaborative pregnancy care pathway designed to optimize outcomes for both mother and baby. Now, that was a very short podcast for a huge pregnancy and diabetes subject. So I'm going to have some closing thoughts. Pregnancy and diabetes can feel overwhelming, but with the right support, education, and healthcare team, healthy outcomes are achievable. Whether you're living with type 1 diabetes, type 2 diabetes, or gestational diabetes, every positive step you take towards managing your glycemic levels helps support your health and your baby's future well-being. Remember, you do not have to navigate this journey alone. Seek support, ask questions, and build a healthcare team that empowers you every step of the way. Thank you for joining me today. Until next time, stay informed, stay supported, and take care of yourself and those around you. Just have a disclaimer, this podcast is intended for educational purposes only and should not replace individual medical advice. Please consult your healthcare team regarding your personal health circumstances. Take care.